talk a little bit about waist circumference and what your waist circumference should be, and then understand actions needed to get rid of that unwanted, nasty belly fat. First, if you've seen my presentations before, you might have seen this, but I'm just going to briefly run through some years here of 1985 through like 2006 of obesity in the United States. And you can see in 1985 here, the percent of obesity in the United States in some states was as high as 10 to 14%. But as you just watch this, as we flip through the years, how obesity in the United States has just skyrocketed. 1992, we started with some states having 15 to 19% of obesity as a population of the population in their states. In 1997, greater than 20% of the people in these states had obesity. Now in 2001, greater than 25% of patients that have, or of the population with obesity. And now some states greater than 30%. So that's where we are today, is that we are just, we're just expanding faster than we know what to do with. What we need to do is we need to stop, for one, further weight gain, but then we also need to lose what we have gained. This next slide that I'm going to show you is a 100-pound difference between two individuals, and it's going to show you where their fat is. And you can see that the yellowish color here is all fat. And as you see more fat in the abdomen area, it's all around the organs. And then it can get into our bloodstreams, and it can get into our organs, and it can cause damage. So this visceral fat inside where our organs are is very unhealthy for us. So not all fat is really created equal. This is a CT scan of fat. You can see in the picture on the left here all the fat around the organs, versus in the picture on the right, it's more subcutaneous fat right around the layer of the skin. The subcutaneous fat, we don't really know that it does a lot to us, but we do know that the abdominal fat, which is the more or less the visceral fat around our abdomen, is very unhealthy for us. In fact, when you have visceral fat around your abdomen, these are all of the chemicals that it is excreting. It's highly active, and it works against us. So here it's secreting angiotensinogen, which raises blood pressure. Here it increases free fatty acids, increases insulin, increases resistance. So all these things add to high cholesterol, high risk for diabetes, or leads to diabetes, and even clotting. This decreases adiponectin, and that basically makes us more hungry. And here's all of this on this side are all like inflammation markers. So it increases risk for asthma, arthritis, inflammation, and even type 2 diabetes. So when we have that belly fat, we are actually working against ourselves, and that belly fat is affecting all of these organs listed here. When you have belly fat, it can affect the lungs through asthma with the inflammation, through obstructive sleep apnea, non-alcoholic fatty liver disease, so you can have fatty liver because you can't keep up with all the body can't process all the carbs and sugars and fats that you're consuming, so it damages the liver. It can cause abnormal menses, infertility, polycystic ovarian disease. It can lead to gout, osteoarthritis, some cancers. Definitely it can cause pancreatitis. It can cause heart disease, diabetes, high cholesterol, high blood pressure, and it can affect the eyes. You have cataracts, you get stroke. So it basically affects every vital organ that we have. It's very important that we know that this belly fat is not just a storage depot, but it is working against us. It is not there to make us happy, healthy and happy, actually. The best predictor of your health risk is really your waist circumference. A lot of people will go by a body mass index, but body mass index, the shorter you are or the taller you are, the less accurate they are. So a body mass index is not one of the best ways to determine what your health risk is. And when people come to our Cardio Wellness Center, everybody gets a waist circumference checked. The standard rule for my Caucasians and African Americans is basically half your height in inches. If you are 70 inches tall, your waist circumference should be 35 inches or less. Now, I did put this slide up here for waist circumference because in our Asian population, they have smaller hips. And so this is what the International Diabetes Federation has recommended for waist circumference in our Asian populations. And that is right on the Japanese men. They have a little bit smaller waist than the Japanese women. So that is correct. I've gotten questions on that. But if you are African American or Caucasian, basically it's half your height in inches. This just talks a little bit about what that visceral or abdominal fat can do. And what your risk is of developing type 2 diabetes. So a lot of type 2 diabetes, and I know more and more people are getting diabetic, but the majority of it is because we let ourselves go. We just let ourselves go and we start eating more carbs and sugars. And it's hard once you get on diabetes medicine to lose the weight and come off of that. And I think somebody had asked a question earlier about does diabetic medicines, help you or hurt you from losing weight. Well, the biggest thing about diabetic medicines that I always tell my patients is as you lose weight and you have low blood sugars and they tell you to eat sugar because your blood sugar is low, you really need to work with your endocrinologist or your primary care physician or whoever is adjusting your diabetic medicines, because too often we feed the medicine. You don't need so much medicine. We need to cut back. Instead of when you're having these low sugars, you feed it. That's not going to help you lose weight. So if you're really committed to losing the weight and eating healthy and you cut back on your carbs and sugars, then you need to work with them on cutting back on your anti-diabetic medications. And that's a really key point if you're diabetic and you need to, come down on some of those medications so you don't have those low blood sugars where you're having to feed it. And this was an interesting study. This was published in 2004, and this is actually when we started doing waist circumference checks here in our wellness centers, really because of this study. And it's the Inter-Heart study, and there is over 29,000 participants from 52 countries in this study, so it's a very large study. And it looked at the reasons for why people came into the hospital with a heart attack. So having abnormal lipids or an abnormal cholesterol profile was about 50% of it. But the next highest risk was abdominal obesity. And pretty much that was similar to the risk for hypertension. So every time you go to your doctor's office, they check your blood pressure, but do they check your waist circumference? Because that's a big risk. And so because of this, we started having all the technicians check waist circumference. And if you don't know where your waist circumference should be, it should be the top of your hip bones to the top of your other hip bone and right across the middle, or what goes to the door first is what you should be measuring. And if you don't know where your hip bone is, if you stand up and you lean far to the right, you're going to feel your hip bone there, and then lean far to the left and you'll feel your hip bone there. But and again, for African Americans and Caucasians, it should be half your height in inches. So tip number 1 for getting rid of belly fat is to change diet. We actually it took us like 20 million years to change our genetic makeup, but in the last 50 years, we have learned to change to look like this guy here on the right, because socially we've been able to figure out how we can push a button, have over 2,000 calories delivered to our doorstep and consumed within 10 to 15 minutes without completing any exercise whatsoever. And that's what we're not genetically designed to do. And in fact, we are living in a world that could be genetically adapted to us, but we don't. In fact, we eat foods that our body is not really made to process. So this is a slide from Dr. O'Keefe, actually, and you can see that people on the left and right are eating foods that is from the land and what we're genetically designed to eat. And the middle slide is what a lot of people eat today, highly processed refined foods. And it's a mix match for what we are genetically designed to eat. In fact, when you see sodas and French fries and cinnamon rolls and all those carbohydrates, what should immediately come to your mind is inflammation, energy drain, and fat storage. Because that's what it's going to do. In 2 hours after eating that, you're going to want to take a nap. So energy drain, fat storage, inflammation. That's what that kind of food does to you. In fact, this was a study done by Dr. Vogel, and this looks at baseline blood flow through the artery at baseline. And then the yellow bar is 4 hours after a high-fat meal. So after your fries, shake, and cheeseburger, look at the blood flow. It's less than half of what it was at baseline. And then 6 hours later, it's not even back to baseline, and many people are on to their next high-fat meal. So it is really important that we work on getting rid of those simple carbs and sugars in our diet. In fact, when we eat foods like that, we're activating a natural system that we have in our body. It's called the renin-angiotensin system. And that is what we have to ward off, or that's what we have actually in our bodies, so that when we meet something like this vicious dog, when we come in contact with this vicious dog, that renin-angiotensin system then constricts our artery and restores our blood pressure, so we don't just pass out when we see something like that, but that we can stay and fight it or flee. And it's for those short-term activations is why we have that renin-angiotensin system. So it constricts our arteries. We can actually survive this. We can actually run instead of just faint. It restores the volume in our system. It gives us vascular integrity. But what happens is we eat things like this flat stacker over here, which is like 4 beef patties, 4 pieces of cheese, 4 things of bacon, 4 squirts of mayonnaise. Anyway, we eat things like that. And what happens is then we have thickening of the vascular wall, plaque growth, clotting, and vascular degradation. So it's not healthy when we have long-term activation. So it's not healthy to our arteries. In addition to, it drains us of our energy, it causes inflammation, it adds to abdominal fat.
Hey, Becky, sorry to interrupt you. Are you on speakerphone? We could have gotten some about
can you not hear me?
Reverberation.
I'm not on a phone. Can you hear me?
Yeah, we can hear you. Just there's some echo in the background. Is there any way you can? Is there anything we can do about that?
Is there a number that I call into then? I mean, I'm only on my laptop.
Oh, keep going then. It's easier this way.
I'm just closer to my laptop. Is this better?
That probably helps, yes.
So in this slide, I don't really show this often, but this is actually a slide where it actually changed how I treated even blood pressure, because I became a little bit more aggressive with treatment of blood pressure. This first left-hand top picture is a slice of aorta in mice, and they gave these mice healthy chow. And when you start seeing the white specks, that's plaque buildup. So in this left-hand picture, you give them healthy chow, hardly any plaque buildup. Then they gave them like a trans fat diet. You start to see a little bit of plaque buildup in the aorta here, but then here, they gave them healthy chow in the bottom left-hand picture. They gave them healthy chow, and then they raised their blood pressure to 140 and 150, and you start to see a little bit more specks. But then on the bottom right one, here they gave them a trans fat diet, so things like from McDonald's with your saturated fats and your burgers, fries, and shakes, those kind of things from fast food places. They gave them the things with saturated fat, a bad diet, and they raise their blood sugar or blood pressure, systolic blood pressure, the top number of the blood pressure to 140, 150, and look how fast that plaque grew. It's huge. So not only do we eat these processed foods that have bad fats in them, but they're loaded with sodium, and they raise our blood pressure. And when they do that, our blood pressure is going to go up, and we're going to have issues with that. So I have this slide on here because it did make me laugh when I first read it. So when I die, I want to go like my grandfather, who went peacefully in his sleep, not screaming in horror like all the passengers in his car. And that is so true. We all want to go like that, right? But what happens is we're living a life that we're unhappy. We've let ourselves go. We're drained of energy. We can't participate. We need to take naps. You know what? I mean, I see patients every day, and probably half of them will tell me, "I'm so tired." Why am I tired? You know, everybody wants me to check a thyroid. Of course I do. And some people, they do have thyroid issues, but for the most part, they had the cinnamon roll before they came in. They had a bunch of sugars. Yesterday I saw an individual who said, "Well, I don't eat sugars." And I went over the diet with this individual, and when you have crackers and protein bars and grains, you know, people don't realize sugar is hidden in so much stuff. And when you eat those things, you're going to have energy drain, fat storage, and fatigue. It's just what it is. So we've got to change our diet. In fact, the primary source of added sugars in the American diet today, could you tell me, is it sodas from fruit drinks? Is it sodas or fruit drinks? Is it sugars and candy? Is it cakes, cookies, and pies? Is it dairy desserts and milk products? Or is it other grain fruits? The number one source is actually soda and fruit drinks, but all of them are sources. So just cutting out soda and fruit drinks, and someone just says to me, patient says to me all the time, "But I just have one soda a day." Well, yes, it's a 32-ounce soda that you sip on all day, and you're getting 32 teaspoons of sugar that you're sipping on, pure sugar. So we really got to change our diet. If you want to get rid of the belly fat, if you want to have energy, if you want to have a healthy lifestyle where you participate in it, you got to get rid of the carbs and sugars. In fact, I tell people that, you know, oftentimes, you know, achieving the ideal body weight is very easy because you have 100% control of it. It takes mental energy, yes. It takes going through sugar withdrawals often, yes. But the only thing stopping you from getting there is you. And all you have to do is change your diet. Some people will say, "Well, I don't eat hardly any sugar." Well, they might have had a small handful of M&Ms. If you have a small handful of M&Ms, 25 pieces is 100 calories, but tons of sugar. Even M&Ms, jelly beans, just 10 jelly beans is going to be loaded with sugar, loaded with calories, cause energy drain and fat storage. So when you look at these things, you've got to say, when you look at these things, you really need to say that I'm not going to have this because I'm going to feel terrible in a couple of hours. The flavor only lasts for a few minutes. The fat, the energy drain, inflammation lasts forever. At least it feels like that until you get your sleep, until you get renewed, and often you're on to your next one. So it will last forever as long as you keep doing it. It stops as long as you stop eating carbs and sugars. You can stop it, but it will continue to happen as long as you eat carbs and sugars. So if we want to avoid that, after sugar consumption, energy drain, and fat storage, we got to cut out sugars. So what should you eat? Everybody often asks me, what should you eat? You should have a lean protein and at least 2 colors, fruits and vegetables, not M&Ms, on your plate at each meal. So when you look at your plate, again, lean protein, at least 2 colors. I should put that. The more color, the better. Now, if you are hungry, you can have any vegetables you want besides 3. Okay, you've got to be careful of potatoes, corn, and peas. They have high sugar index. Can you have them? Sure, but you've got to be careful of potatoes, corn, and peas. But you can have all the red, green, yellow bell peppers, radishes, cucumbers, celery, broccoli, cauliflower, green beans, squash, zucchini. You can have all that you want. If you're hungry, make yourself a big, huge salad. If you say to me, I can have all that I want, but it's not going to fill me up, my reply is often, No, it's not going to take care of your sugar withdrawal. So sometimes we eat because you don't want to face the sugar withdrawal, not because you're necessarily hungry. Lean proteins, healthy nuts, turkey, chicken, fish. Red meat is not terrible for you. In fact, if you can get meats that end in loins and rounds, they're usually leaner cuts of meats. Now, you don't want to have it three times a day, each day of the week. But in moderation, sure, and get the leaner type of meats. All natural protein, whey protein, non-fat cottage cheese, non-fat plain Greek yogurt are all sources of lean proteins. And the biggest thing that you can do for yourself is to avoid pastries and sugary foods. And the typical portion of your meat, of your protein, is actually in the size of the palm of your hand. You carry your portion with you. So that's how much you should have. Okay, the next tip, which is one of the biggest tips, besides getting rid of sugar in your diet, another big tip for getting rid of belly fat. Oh, I forgot. Got to rate your plate. The more color, the better. But the big tip for getting rid of belly fat, the number 2 tip for getting rid of belly fat is in the exercise, but it's not the duration of the exercise, but the intensity of the exercise. You need to do things like interval training. In interval training or burst training, some of you have probably already done it, and many of you I've talked to them about, but basically what you do is for about 30 to 60 seconds, you put in 90 to 100% of your maximum effort of what you're currently doing, and then you go back down to your normal pace, and then after 5 minutes or so, you do another burst of this intensity, of this intense exercise. So let's say I have a patient that comes to me, and he or she tells me, well, I walk 3 miles 4 times a week. I've done so for 2 years. Well, that's not making them any more fit. All right, it is healthy to walk every day, but what I tell them to do is, okay, I want them to warm up, and after they're warmed up, I want them to walk for 30 seconds to a minute, as fast as they can without running. And then I want them to go back to their normal pace, which should be a brisk pace, but their normal brisk pace. And then after 4 or 5 minutes, do another burst. So, and do that interval all the time. If you're on a cycle, do it for 20 or 30 seconds. You cycle, if you're doing a stationary bike, then after about 4 or 5 minutes, go for 20 seconds, 30 seconds as fast as you can, and then go back to your brisk pace. But you want to do these intensity trainings. It's not about going longer. It's not about doing ab crunches and all that as much as it's about getting these bursts of energy. If you want to, run stairs, do it real quick. That gets metabolism going, and it's a burst. It's an intensity burst. I will say walking does reduce your risk for heart disease by 50% every day, and walking is the least, by 50% overall, but walking is the least aborted exercise. It's the least exercise that someone quits. So a lot of times people say, I don't have time to exercise. Well, I'm not asking someone to go to the gym for an hour. A lot of people think they have to do this big workout. But you can do short interval bursts throughout your day, anywhere, at work or anywhere. It takes 5 or 10 minutes if you want to do these burst exercises. So run the stairs, do a sprint down the street, walk quickly around the building as fast as you can. But you do these bursts of exercise, that's going to get rid of that extra flab around your stomach, and it's going to help make you more fit. So you want to do interval training, and then I do recommend some core exercises because it kind of helps you get more sleek and starts to form your abdomen for you when you do some core exercises. But you can do those every day. If you're brushing your teeth, stand on one leg. You can do planks, for 1 minute or 2 minutes, wherever you're at. But it's doing these types of core exercises throughout your day and some interval training throughout your day or throughout your week is what's going to help get rid of the belly fat. But it's not going to help you get rid of belly fat if you're still putting in carbs and sugars, because your belly or your liver has got to process those carbs and sugars, and if it's still processing carbs and sugars from last week and you're putting more in, it can't do that. It can't process it. So what happens is we end up getting fatty livers, and we end up having a lot of further health risks, health problems with that. I added this third tip in here just because I've seen a lot of this recently, and sugars get in our system in tricky ways and in tricky foods. And so we do need to avoid protein bars, we need to avoid grains. And I'll talk about grains in a second, but recently I've seen a lot of people saying I have protein bars, for snacks. They think they're healthy. They're loaded with carbohydrates. Look at your protein bar. If you have protein bar, I had, somebody said, well, mine's only like 15 grams of sugar or 10 grams of sugar, and but if you that adds up. You got 30 grams and 20 grams of sugar that your body doesn't need extra, can't process it. It's going to cause energy drain and fat storage. It's going to cause inflammation, and I've not seen one person lose weight and be healthy by eating protein bars. The only way to be as healthy as you can be and to lose weight is to eat foods that we are meant to eat, lean proteins and fruits and vegetables. On the grains, the seed, the wheat seed itself, contains 30% more carbohydrates than what it did in the 1920s and 1950s. The wheat will cause inflammation, asthma-inducing, allergies-inducing, arthritis-inducing, pain. So people think, oh, I eat whole bread. I have whole grain bread for breakfast. I have whole grain bread on my sandwich at lunch. I have whole grain, bread with my meal at night. And they say I should be fine. I've got whole grains. Well, what it is sugar, sugar, and sugar. So it's not going to help you get rid of the carbs and sugars in your body. It's not going to help you get rid of belly fat. And if you want to know more about it, I highly recommend you read the book Wheat Belly, because it really talks more in detail about what wheat and the grains can actually do for you. And then the fourth tip of getting rid of belly fat, I strongly encourage people, is to take the CardioT. I take it. I think it's healthy. It's 2 capsules daily. And what CardioT does, it naturally speeds up your metabolism. So if you're doing all these things and you want something to supplement and help you get rid of the belly fat, is to take 2 capsules of the CardioT daily. It also will help lower your LDL, your bad cholesterol. The caffeine in it is what's in a decaffeinated cup of coffee. And what's really interesting about the CardioTabs CardioT is it contains theanine, which is for focus and clarity. So there's a lot of good things that comes with CardioT. So to wrap up here, tips for getting rid of belly fat: change your diet, eat foods that were genetically designed to eat, exercise with burst training or interval training, and do some core exercises to just kind of shape those muscles. Avoid grains and protein bars, and invest in CardioT. Thanks for listening. This was the promotion code for listening today. If you type in TREAT to your online orders. And Aaron, I don't know if they can phone in and use TREAT. I'll let you talk from here.
Right.
But
right, yeah, you can call in, or you can go online and just enter a promotion code or mention promotion code TREAT, and it will save you 13%. It doesn't matter either way, online or via phone.
Okay, and I've got questions. Can I do some questions now?
Sure, if you got time for a couple questions.
Sure. Let's see here. I've heard recently on Dr. Oz that whole milk is an acceptable food of choice and to avoid skim milk. What are your thoughts? We're still on the thoughts of skim milk not having the excess fat. Skim milk, it gets some bad rap because it has some sugars in it, some natural sugars in it, but there's not a lot of sugars when you have skim milk, and you're getting tons of protein with that, and you're getting your calcium with it. So I would not purposely have milk that's going to add more to your cholesterol and more fat. But an 8-ounce glass of skim milk is not going to be harmful to you at all. In fact, it's actually good for you. I think I've answered this one. Do core strengthening exercise influence abdominal fat? Core strengthening is going to help shape your abdominal muscles, is what it's going to do. It's going to help shape those abdominal muscles, and it's going to help your posture and make all that firm. The biggest thing for really getting rid of your belly fat is getting rid of the carbs and sugars and doing some interval burst training. And the more of those interval burst training, you can get a pretty intense exercise when you do those in just 2 or 3 minutes. and you can do it several times during the day at those burst intervals. And then the CardioTabs, those are the three things. If you really want to get rid of your belly fat, those are the three things that will help you. And I know I had that fourth one in there, which was the grains and the protein bar, because people don't really think that they're loaded with sugar, but they are. Does stress affect belly fat? Absolutely, because it raises our cortisol level, which raises our sugars, which becomes lethargic. So yes, I mean, you usually get less sleep when you're stressed. I've done that a few times, but when you get less sleep, what happens is you're eating things that you wouldn't be eating when you're asleep, and also it is raising your cortisol levels. In fact, Dr. O'Keefe has just had his new newsletter out, which I have. It just came out yesterday. If you go to cardiowellnesscenter.org, the newsletters are on there, and he has a sleep cycle on there, and it talks about like when you get less sleep and what your sleep hours should be. And if you don't get that, what diseases you are at increased risk for having. So that should be posted in the next couple of days. And that's at cardiowellnesscenter.org, and click on newsletter. The new one should be there in the next couple of days. So this one's really interesting. When I was skinny a few years ago, I still had belly fat. Why is that? And I'll just finish with this one. The reason is because we're actually designed to kind of store a little bit of fat, so when we hit starvation mode or we don't get food, you know, if we're eating from the land and we don't have food, we're supposed to store a little bit. And so the last fat that goes is the one in our trunk, kind of in our abdomen, because that's really where we're supposed to store our fat. And what happens is we get bigger and bigger and we eat too much, then it goes out to our chest, our arms, our fingers, our legs, our toes, and you know, it just gets, because it's finding places to store it is what it's doing. But what we're meant to do is just to store a little extra in our abdomen, so if we hit starvation or if we starve ourselves, we'll have something to come from. So that's the last fat to go. But you can still do it, and it's probably, I don't know if you were having carbs and sugars at that time. I don't know if you were doing any core exercises or interval exercises, but that's the way to get rid of that last bit of stubborn fat, and that is the hardest one to get rid of, but you can do it. I think that's all. Oh, I think there was one asked, is corrective abdominal tuck is that ever a solution? You know, I'm not for surgical procedures like that, because if you don't cut out your carbs and sugars now, you're still going to be addicted and you're still going to have the problem. So I'm not really in for the abdominal tuck to get rid of belly fat when I think we can do it naturally. Thank you.
Okay, there's also, Becky, you have an event coming up on November 7th, right, at the Jewish Community Center on health and wellness?
I do. In fact, everybody's welcome to that. It's a free seminar. We've had standing room only, so we did move it to the Jewish Community Center. It's from 6 to 8 p.m. on November 7th. And it's our Cardio Wellness Healthy Happy Hour. Dr. O'Keefe will be speaking. And he takes questions from the audience, and it's great to hear the questions and what comes in. So will Dr. Mo. I'll talk a little bit more about our wellness center. And our other nurse practitioner, Shirley's going to speak on diet drinks and artificial sweeteners. So everybody's got about a 20-minute presentation, and there'll be fruits and vegetables and hummus and nuts and coffee, tea, and wine. So please join us. To RSVP, if you would, if you want to call the 816-751-8388. 816-751-8388. That's to make sure that we have a right amount of fruits and vegetables, lean protein and colors for you all.